Well, great morning, everyone. Welcome to Plan Well, Live Well. I'm Jackie.
And I'm Ethan.
And today's show, we're going to be talking about understanding long term care versus health care. So, as your advisors, we have a great show today. We want to educate you about this subject matter. So,
Great. Yes, Jackie. So long-term care versus healthcare. That is, a big misconception as people who are planning for healthcare do not necessarily understand that long-term care is not part of the healthcare system, right? Healthcare, right, as we know it, is medical necessity. So, what can you tell us? I mean, about some of those misconceptions or some of these things that surrounding long-term care and healthcare.
you know what, Ethan, is that's a good question because when we're meeting with folks, especially if I'm advising someone, the first thing I talk about is when if they're Medicare eligible, is letting them know that A, it's not covered by Medicare, number one, and number two, some of the that's approached to me is definitely affordable. It's one of those protections that you want to get in advance of a critical illness, and it is affordable if you're young and you're healthy. So those are the two components, and we come across that all the time. That this type of protection is important, it's necessary, and um, seniors are, and not so much even seniors. If someone has a heart attack or stroke and they need this type of care, um, it can affect you at any age.
I mean, you're right. At any age, and this is interesting enough. I mean, we've been doing this for quite a long time. I have, fortunately, have seen. I always tell people that you see your life, you see your family's life, and maybe your neighbor's life. But I see my life, my family's life, my neighbor's life, and my client's life. So I see 15 to 20 lives a week, and I have been in situations where I saw a man my age tell me a story of why he is currently in home care. This was a long time ago, and he went down his long driveway during appears to be a little icy, slipped on the ice, and he's paralyzed from the neck down in his 40s. So a lot of people think of long-term care as old age care insurance or care protection, but it statistically, people our age, Jackie, we'll say 40 to 50-year-olds, we have a 40% chance of needing long-term care because of a disability, right? Getting hurt on the job or getting hurt personally. Now, once you get into, my parents' age and, the clients that we service a lot, which is people over 60, to 80 years old, yes, they also have a disability that can happen due at work or due to an accident home, but mostly for them, it's due to old age, falling, and or being sick. So this is long-term care is not an old age type of planning, but as it relates to healthcare, so I wanted to kind of talk a little bit about that, right? So healthcare is medical. So I had a gentleman, this is not long-term care related, but I had a gentleman call me yesterday and said, hey, will my health care pay for my dental procedure? I said, so, we went through probably like a 10, 15-minute conversation, but I'll summarize it. And I said, in this country, medical is not dental, it's not vision, and it's not long-term care. But dental could be medical, vision could be medical, and long-term care could be medical under the right circumstances. So, and I gave an example for the dental. I said to him, what you need sounds like it's dental. Talk to your dentist. But your dental surgeon is typically a medical doctor and a dental surgeon. That's how they are. And there could be a case where I gave an example. The case was this person needed some dental work, but at the same time, they also needed a medical procedure on their jaw. And the doctor basically said, hey, if I can crack your jaw in a hospital That's medical. But while I've cracked your jaw and put it back together in the hospital, I can do your dental procedure while I'm there. But if you don't want me to crack your jaw and put you under anesthesia and have a 2-week recovery period, well, it's a dental procedure, and I have to charge you, we'll say $5,000. And under the medical procedure, which is the cracking the jaw, it was a $500 copay for their medical insurance. So that's how medical and non-medical work. And I think as it relates to long-term care, people need to understand that medical long-term care is not long-term care. Medical long-term care is typically an acute short-term care situation, maybe after a stroke, maybe after a fall, and then you get some, physical therapy, some inpatient physical therapy, some inpatient care. But once that problem turns into a long-term problem, 3 months, 6 months, 1 year, for the rest of your life, health insurance is not paying for that. That is something called long-term care. So we have a lot of information for you. We have some videos for you, and we'll talk a little bit more about that for you. But as we promised, when Jackie and I are hosting and when Jackie and I are guests, we're going to bring some awareness to a national event today. And this national event today is called National Day of Unplugging. This day is March 3rd, and it's an interesting day. We have some awareness, some information for you guys all. And so here's what some of the results, this is some public records, and this is what some of the survey have said about us being connected. Now we are online, so we are connected today, but this is what the survey said about the National Unplugging Day. So it says that the survey's results say 75% of Americans spend anywhere from 3 to 10 hours a day on their device. So think about it.
Device.
What could you be doing in those 3 to 10 hours a day? What could you be doing, Jackie? You could be sleeping. I know Jackie could be sleeping.
I could be sleeping. I need to go to the gym. How about just reading a book and getting some fresh air? How about that?
48% spend 5 or more hours per day, while 30% spend 10 hours or more. So look. So 13% of the country is on their device 10 hours or more. And so it's a problem.
And that's us.
It's a problem, or it's not a problem for some people, but it is today National Day of Unplugging, and here's what they recommend for us to do. And I'm certainly going to try to do this after we're done with the show, because we are on the show, so we are on our devices. So here's what they recommend to do. They recommend that we put our phone in a box for 24 hours. Let's throw a dance party, Jackie. Why don't we first let's high five. Okay?
I want to dance.
Let's do it. Throw a dance party and then volunteer to help others. So I'm going to try to help my children do this for 24 hours, because I think that my children are on their device
all the time,
more than 10 hours.
It's like it's super glued to the palm of your hand, because you're constantly texting, incoming, outgoing. I'm looking forward to unplugging. I need to unplug.
That's right. So hopefully this is a good awareness for you folks. We will continue to bring these whenever Jackie and I are hosting and we're the guests. So we will keep bringing this awareness on National Day events for our folks. So now we're going to transition into our plan segment.
That's right. And
we're going to have a treat for you guys today about this topic of understanding long-term care versus healthcare. All right. So, all right, stay tuned. Here we go. Welcome back.
Welcome back.
So, we are going to talk about our plan segment, which is our insurance, retirement, and real estate segment. And we have some videos for you. And we're going to play a little bit of videos so that, you can understand a little bit about long-term care and how it works. All right, folks. So we have a treat for you. And here's a video. This video will explain to you a little bit about the technical aspects of long-term care. So here we go.
If you are like most people, you don't like to think about the consequences of aging. But have you considered how the need for assisted care could affect you and your family in the future? You may be surprised to learn that Medicare may not cover many of the costs associated with aging. Let's take a look at some of the common questions people just like you have when considering insurance coverage for assisted care. Will I need assisted care? 70% of Americans over 65 can expect to use some form of long-term care services during their lives. Will my family be willing to work as my unpaid caregivers as I age? How will those responsibilities affect their lives? How will I pay for assisted care needs? Typically, Medicare and most health insurance plans don't fully cover your assisted care needs, and Medicare generally does not cover custodial care, which makes up most of the care provided in nursing homes, assisted living facilities, or in your home. So what are your options? There are a variety of insurance products that can provide coverage to help meet your needs for assisted care. Think of these insurance policies as a benefit account for your future healthcare needs. The policy works by offering a benefit pool, which is calculated by first choosing a number of days of coverage and second, choosing a daily benefit amount. If you need to pay for healthcare costs, benefits may be paid from the account until there are no benefits remaining, but your daily benefit amount limits what may be paid in a single day. The days of coverage do not have to be consecutive. Generally, these insurance policies provide benefits when a person is unable to perform 2 of 6 activities of daily living or is severely cognitively impaired. The events that will trigger benefits vary by insurance product. Let's look at examples of how a long-term care insurance policy can provide benefits for assisted care over the course of coverage. Consider Mary's story. Mary chose a policy that covers 365 days of care. She selected a daily benefit amount of $200 per day. This equals a total benefit pool of $73,000. When Mary selected her policy, she knew she wanted to receive care at home. Additionally, Mary's daughter Sue lives nearby. Sue's schedule allows her to assist with Mary's care needs 2 days a week. Now let's see how Mary's coverage works. Assisted care at home typically costs about $46,000 per year, or about $126 per day. She'll need this care 5 days a week since Sue is assisting the other 2 days. After receiving home care for 365 days, Mary will still have $27,000 remaining in her benefit pool. This coverage will last longer than 1 calendar year as Mary is only receiving care on weekdays. How big of a benefit pool do you need? Over half of all long-term care claims last only 1 year or less. However, some claims last longer. So it's important to choose the type of insurance and the amount of insurance you can afford. Any coverage may be beneficial because it can help ease the burden on your future finances and the stress put on your family.
Okay, everybody.
Wow, Ethan, that was a lot of information to
That
unpack.
was.
But I will say it provided a real simplistic approach as to how the care works, how it's affordable, or how simplified it is if I were to sit down and have the conversation with my family or with advisors like you and I to better understand the type of coverage that I need, and gets me more prepared to have that conversation with advisors. So thank you. I'm glad that we shared that with our viewing audience.
Yeah, so that was a technical breakdown of the fundamentals of how to purchase long-term care. So I get a lot of questions. People are definitely confused about long-term care. And so long-term care is a pool of money that you purchase. You don't know how much you need. Certainly, there are some strategies that we use to help you find that out. Most people don't know how much long-term care they need. So we, as advisors, we have certain, metrics and strategies that we use. The 2 most common strategies to know how much long-term care is, the most common, people look at their budget. How much monthly premium budget can they afford? That is usually the number one concern. So some people don't really want strategy. They want to build me a package where I can afford $100 a month, $300 a month. That's the most common thing that we see. Strategically, though, it's best for us as advisors to do a little fact finding, to like a doctor. You go to a doctor, say, "Doctor, I want surgery." It doesn't say, "Let's go ahead and cut you up." He does his blood work, his urine test, x-rays, echoes, and then he analyzes the data, and then he makes a recommendation. So same thing for us. I mean, we're licensed advisors. The best way to do it is, you tell us your needs, your family makeup, your assets, your liquid assets, your disposable income. When will you be retiring? What will your disposable income be at retirement? What are your assets? How much will you be drawing? What are your risks? What are your children's needs? Where do your children live? Will they be willing to help? Have you had the conversation with them about this stuff? So, tell me, Jackie, how often do you hear from our customers that, my kids will take care of me?
All the time. And it's not that this type of coverage is a replacement for your kids, but we're all busy and we all have active lives. So in order for you to give your loved one the proper care that they need and the proper care that they deserve, you have to be mindful, because not only if you're sick, you're affecting your household, but when you put demands on someone to care for you, that also affects their household. So it's definitely, to your point, putting in a strategy, putting in a plan in place, having that conversation so you can truly plan for how your son or your daughter or your loved one is going to care for you and what your needs are going to be. And the beauty of a short-term care policy, a long-term care policy, is it doesn't, like the video said, it doesn't have to be consecutive. So you could have the plan in place for a couple of hours, and then while your loved one is at work or at home, and then it could substitute. So I love the fact that you can get professional care and care from a loved one at the same time. And it almost as if it stretches your pool of money, really, if it's used properly.
Right.
So that's where we as advisors can help someone when they get this policy, and if they should decide that they need to put it in place, how we can help them navigate that so they can maximize that pool of money.
And you're right. And what we heard in the video basically said that most insurances, whether it be Medicare, your insurance at work, most health insurance policies, they don't pay for this type of care, because 90% or so of this care is called custodial care, which you guys saw in the video is eating, bathing, toileting, transferring, showering. Those things certainly do occur during a medical situation, when people after a stroke or after a fall or after an accident. But typically under health insurance, that's a short-term situation called medically necessary care. But for the most part, anything beyond 100 days, everybody should look into their health insurance contracts. At work, your personal, your family ones, your Medicare. You get a benefits book. You can call the 800 number to your policy. You can call us. We can help you. Most people don't know about their benefits until they actually start to use them. So I encourage everybody to look into their benefits book right now and find the benefits that says skilled care, medical skilled care. Everybody will notice that health insurance only provides about 100 days or so. So if you need 1 year, 2 years, 3 years, or longer, that's where we're trying to have this segment to an extent. That is not considered healthcare. That is considered long-term care. And just like you need dental insurance, vision insurance, you need long-term care insurance, just like you need car insurance. So everything has its name. So care is long-term care, and that's a separate insurance policy. So Jackie, we also have another video for our folks. We'll call it a third-party video. It's a very popular podcast. We found his video on YouTube. Dave Ramsey, we're going to play it for our guests. Certainly you guys can find his videos yourself, but we are going to play this for our guests today. And he's talking about this very topic. So let's see what he's got to say. We'll play his video for a few minutes. Here we go.
David is in Montgomery, Alabama. Hi, David. Welcome to the Ramsey Show.
Good afternoon, gentlemen. How are you guys doing today?
Better than we deserve. What's up?
Fantastic. So I'm looking into long-term care insurance for my wife. She's 55. Actually, we're both 55. So we probably need to wait another 5 years, as usually recommend 60.
Yes,
but
sir.
understanding that, my question is, when do I consider her self-insured as I think we're kind of on the cut line for considering ourselves self-insured or needing long-term care.
Yeah. Well, self-insured always means you can take the hit for the expense without disrupting the whole plan. Okay? So let's kind of walk that through. The average nursing home stay in America is 2.5 years. Typically, the typical scenario is 75% of the ladies outlive their husbands. And so the typical scenario is Papa goes into the nursing home, burns through 300 grand. And if that was the entire nest egg, he cracks and scrambles the nest egg and scrambled eggs and dies and leaves mama with nothing. Okay. So we obviously don't want that. So if your entire net worth is 300 grand, you can't do that. You have to have good long-term care insurance. If your entire net worth is $10 million, you can write a $300,000 check and not blink. So if the average nursing home stay is 2.5 years and the average cost is around $100,000 a year, then that's $250,000 to $300,000 is your typical exposure. Could it be more? Yeah, it could be, but it probably won't be. And you could do in-home care even cheaper than that and maybe get better quality care depending on the type of issue that you're dealing with in terms of caring for the individual. So all that to say, if you can take a $300,000 hit and the person that's left keep rolling, then you're okay. So if you got $1 million and they're left with 700, are you okay? Yeah, probably.
Yeah, okay, that makes sense.
All right.
Wow, those numbers
Wow.
that he referenced.
They're through the roof, and let's unpack this video. And Dave Ransby, he talks about many different things, and I found his video and I thought it would be interesting for our segment. But let's look at some statistics of the care. I mean, he gave the numbers for the average care, the average cost, and Papa Bear, Mama Bear. Certainly, men outlive women. Women outlive men.
That's right.
And an interesting fact. Life insurance is more expensive for men because women outlive men. And here's the flip side of it. Long-term care insurance is more expensive for women for the same fact because women outlive the men. Okay, so let's look at some, you all can Google this information yourself, but how many people in this country have a nest egg of $300,000? I would say they don't. So, I don't know what that number is. I think something like 60% of the country has less than $100,000. Okay, and you guys you all can find that information online. Maybe we'll have another segment. I'll have some of those statistics of people that answer. You, our viewers, our guests, you'll know your assets. But what they've said that let's assume you have $300,000, $500,000, $600,000. One of you goes into a long-term care situation, you spend $300,000. The other one potentially is bankrupt, okay, going on welfare. Or both of you go into husband and wife, both of you go into long-term care, and both of you become bankrupt. So depending on your goals for each other as spouses, and depending on your goals of legacy planning for your heirs, your grandchildren, your children, I like his term, crack the egg. Will long-term care crack the egg? What are your thoughts, Jackie?
I know that I've worked very hard for my 401k, and we meet with folks. Very few have pensions, but those who have pensions, those who have 401ks, you've worked very hard to accumulate that wealth, to set aside money for yourself to have in retirement, to put alongside your Social Security income. So do you want to spend all of your nest egg paying medical bills? Of course not. You want to have some type of enjoyment. So this is where that long-term care policy, where you're not self-funding, that you're taking that financial pressure off of yourself and having a policy in place or a plan in place to cover that expense. So that was the takeaway message for me, that I want to preserve some of that money. I don't want to spend it all on my healthcare.
That's right. That's right, Jackie. So hopefully to our viewers, and this was a great segment. And when Jackie and I are hosting and we are the guests, we're going to have a little fun. So we're going to play a little game right now. Jackie is going to ask me some questions about long-term care. And if I get the questions right, I'll win some money. And what our show does is once I win some money, the show will double that money and we'll donate that to a good cause. And then we'll play a spinning game where we'll determine who will be, who will get that money. Okay. So Jackie, let's go ahead and play that game.
Well, you are such the expert, subject matter expert when it comes to this. So my first question for you, Ethan, is how unpacking the video. What's the average that someone stays in a nursing home?
So the average care typically could be anywhere from 1 to 2.5 years, and that is depending on how much time they spend at home. But the average care nursing home is 1 to 2.5 years.
Okay. So one of the things that the video, what's the difference between private pay versus state?
Okay, good question. So private pay is when you use your own income or your own assets, similar to when you go on vacation, you privately pay for the hotel and you privately pay for the accommodations of the hotel. When you go into a nursing home or under home care situations, the same thing. You privately pay for the accommodations inside a nursing home. Government pay is, unfortunately, when a person is has little income and almost to no assets. And government pay is funded by Medicaid welfare, which is technically funded by the federal government, appropriated by the state government through the welfare Medicaid program. And the state subsidizes your care. But for you to qualify, you have to have spent down most of your assets. And if you have any income, most of your income would be used to pay for care. Now, we have a lot of customers that have very high income. Over my years, I've met a customer, even in retirement, they got $12,000 a month in income. And, they didn't have to use their assets because they had enough income to cover them. But that's not the majority of people who are in retirement and they still have $12,000 to $15,000 to $20,000 a month in income in retirement. But in any event, the state welfare program will pay for you if you are in a low income, low asset situation. So how much did I win so far, Jackie? Did I get the two questions right?
You did. And boy, were they in depth too. So I would say you're up to $2 for the first question, $4 for the second question, and we're to our third question, and it's for $6. So let's see. So the final question is going to be a good one. What are the most common activities of daily living that you've seen clients experience or had that conversation with those? Can you name them?
Sure, I can name you all of them, but I'll tell you what I've seen in my 15 years and with my grandmother too. It's eating, and eating is feeding yourself, not just making your own food. It's actually being able to feed yourself. Eating, dressing, whether you can't put on your socks or you can't put on your sweater, dressing, bathing, whether you can't wash your hair or your back, transferring, getting out of bed or into a car or out of your chair, toileting, going to the bathroom, and incontinence. So 6 things. And typically, to be able to qualify for an event under your long-term care insurance policy, you need not be able to do 2 out of those 6 at any given time. You need care. But the most common things that I see, and doing this for a long time, and I've seen all kinds of different things. There's so many different situations, but the most common things that I see, it's dressing. Because I have situations where people don't think that if they can't put on their shoes and their socks, they don't need help. That's not true. If you can't put on your shoes or your socks, you can't get out to the doctor's appointment. You can't go anywhere.
Grocery shopping.
Right. So putting on your shoes and your socks. So dressing is common. Showering. I have a lot of people that think that, I sit in a chair and I use a stick and No, if you have a hard time showering, that is considered a need. And then transferring is a biggie. Having a hard time getting out of bed, having a hard time getting down the steps in their house, having a hard time getting in the car, or having a hard time getting into the shower or the toilet without some type of assistance. So the three major things that I see is transferring, showering, and dressing.
Okay. That was definitely a loaded $6 question.
Yeah, so I want how much, Jackie?
Let's see, $6, $10, $12.
So $12. So
and we're going to spin the wheel.
So the $12 that I won, the show is going to double that. So the show will donate $24 to a local cause or a local organization or an organization, and we're going to find out which organization after we play our spin game. So let's take a look here, and we're going to play the spin game now.
Yes. Oh, wow. Look at that. That's a colorful wheel.
Yes. So let's play this game. So here's the organizations that we're going to be donating to.
So you have the muscular dystrophy.
Muscular dystrophy, yeah. Alzheimer's Association, local food bank, my pick, and if I hit on double my pick, so I won $12. The show doubles that to $24, and if I hit double my pick, then the show will donate $48. All right, so let's give a spin here.
All right, double your pick, double your pick, double your pick. Your pick. So which one do you choose?
All right. Yes. So my pick is going to be cancer.
Okay.
I have we're going to donate the money to the cancer awareness organization. We'll find it. It's not on the list here, but I have a special connection with that. Unfortunately, one of my best friends had died at a very young age from cancer. And it's a very dear heart. And, cancer is a very big disease in this country. I think it's a top 3 disease. So our show, Plan Well, Live Well, will donate $48 to a cancer organization. Jackie, thank you for playing with me. And yes. So now what we're going to do is we're going to talk a little bit about our guest next week. And the guest next week is Janice. Jackie, can you tell us a little about our guest next week?
Janice Pompey. She is the marketing director for Dedicated Senior Medical Center. That's here in the Philadelphia area. And she's going to speak to us about how seniors can get their care with a primary care facility and all of that this facility offers. It's like one-stop shopping under one roof. And that's important when seniors are getting their care, how they navigate that care, and you have a team of folks working with you to navigate your health. So I like their approach, and I'd love to hear Janice and talk about how that company is pretty much a national company. It's called Chen Med, and how their business model really targeted the senior community and what she's doing to engage those seniors, and how that company is crafting their care plan specifically to the senior market. So it's definitely going to be a good conversation. And for folks who aren't familiar with their business model and how they get a primary care physician and all that facility offers, and what Janice is doing in the community to educate folks about these services. So it's going to be a great show.
Well, thank you, Jackie. So here we go. And everybody, thank you for joining us today. And as always, please go to our YouTube channel, Plan Well to Live Well. Click on the calendar link in the description. Book a free consultation with Jackie or myself to talk about your insurance, to talk about your retirement, to talk about your real estate. And also, you can use that link to post questions, ask us to discuss a topic. All that is very important. We love to hear from our guests, and as well as if you want to be a featured guest, if you have a business under the Plan Well, Live Well, whether you're a nutrition, whether you're an advisor, doesn't matter. If you want to be a guest speaker, or if you want to be a sponsor of our show or an advertiser of our show, same, please go to our YouTube channel, Plan Well to Live Well, click on the calendar link and schedule a meeting. Follow us, like us on Facebook, subscribe to our YouTube channel. Thank you again, everybody, and look forward to seeing you next week on our show. We enjoy your company, and everybody take care. Please tune in next week. And
That's right.
Jackie.
Hey, and as always, we want you to plan well, to live well. Take care, everybody.